Hi, everyone. Welcome to our special event. This is titled Student Physician Wellness in the Present Era. And I'm honored and delighted to be introducing our guest speaker, Dr. Patrice A. Harris. Dr. Harris is a psychiatrist from Atlanta, and she was the 174th president of the American Medical Association. She was also the organization's first African-American woman to hold this position. Dr. Harris has a diverse experience as a private practicing physician, a county public health director, a patient advocate, and a med society lobbyist. Since 2014, she has been leading the AMA's effort to end the opioid epidemic as chair of the AMA's opioid task force. She's also been, or she has been, at the forefront of working with every state to eliminate barriers to treatment, to provide patients with access to affordable, non-opioid based pain care, and to fight the stigma faced by those suffering with substance use disorders. She's held numerous leadership roles both in the AMA and elsewhere, including the American Psychiatric Association and the Medical Association of Georgia. Growing up in Bluefield, West Virginia, Dr. Harris dreamt of entering medicine at a time when few women of color were encouraged to become physicians. She spent her formative years at West Virginia University, earning a BA in psychology, a master's in counseling psychology, and ultimately a medical degree. She continues in private practice today in Atlanta, and she is an adjunct assistant professor at both Emory University and Morehouse School of Medicine, both in Atlanta. And then I believe also she's a visiting professor at Columbia. I'll let her go into that maybe. Lastly, yeah, she's a recognized expert in children's mental health and childhood trauma. And so in my opinion, she's one of the best people in this country for us to hear speak on the topic of medical student wellness. We've all been through a lot this year, so what a privilege it'll be to listen and chat with her tonight. So thank you, Dr. Harris, and welcome.
Well, thank you very much for having me. I always say yes to medical students. So when I was first elected president-elect, because for those of you who don't know the AMA politics, you are elected as president-elect, and I told the team that I wanted to always say yes to any invitation from medical students if I could possibly do it and had the time and didn't have any conflicts on my schedule. So I'm so honored to be here with you tonight and have this conversation. I'm really going to talk about some broader issues and leadership. Been saying a lot, leadership matters, representation matters. And so medical students being engaged and involved matters. Your voice is important. There is no playbook. None of us have a playbook for what we are going through right now with all of the myriad issues that COVID-19 is bringing to the fore. And that's why it's so important for us to have these conversations and work through these challenges together, be solution focused, and make sure that we are consistent in our advocacy, both for ourselves as individuals, but for our profession and for our patients. I also want to give a quick shout out to Misney. Later on in my brief presentation, I'm going to talk for about 20 minutes or so about the AMA and some of the ways we're trying to lead on issues regarding wellness and burnout and other issues that we are facing right now. And one of those issues is health inequities in our country. And I will always be forever grateful to Misney, who put forth a resolution at the AMA asking us really broadly, I'm paraphrasing, it was specifically regarding health equity and a committee that we had commissioned on to end health disparities, but it was really elevating the importance of the AMA having what might be health equity 2.0. And so I'm so grateful for Misney for amplifying that issue. And I believe, yes, pushing us, I was chair of the board at that time, to really looking at what we were doing and how we were addressing these issues. And I've said so many times, I think we would have had a story to tell without our new Center for Health Equity, but our story is so powerful now, and boy, is it needed. And so COVID-19 has brought to fore issues around health inequities, issues around our crumbling, as some would say, non-existent public health structure, our lack of a mental health infrastructure in this country overall, and specifically when it comes to us as medical students and physicians. We seem to have a system that disincentivizes us even asking for help, raising these issues. That is slowly changing, and that's where leadership matters and representation matters and our voices matter. Oh, and I just see my fellow board member here, Tom, and it's such a wonderful pleasure to serve on the AMA board with him. And by the way, Frank and I go a long ways back, and so good to see him on the call. But certainly all of these issues matter, and our voice matters as we address issues from health inequities, lack of access to affordable healthcare, lack of access to COVID testing, right? And I'll say a little bit more. Oh, and Charles, I didn't want to forget you. I'll say a little bit about that more towards the end of my talk, and certainly medical student and physician mental health and burnout. So I will attempt to share my screen. It worked in rehearsal, and so let's see if it works right now.
Yep.
Very good.
As you're pulling it up, just quick ground rules about Q&A. We have the Q&A open, and you can chat with us and the panelists with that. But we hope that you'll hold questions till we're open for the Q&A by raising your hand. That'll let us see you, and that'll give you the chance to ask your question. You don't have to be on camera for it, but your microphone will be opened up. And so we'll do questions in that way. So thanks for holding them. We thank you for the questions that you put out already. And yeah, sorry to interrupt, Dr. Harris.
No worries, no worries. Important. Housekeeping, very important. And so I think, a theme here, as I said, is leadership. And as we are entering, or actually not entering, but sort of navigating our way through this time of crisis and the transition, it is important that we in our profession lead. Our medical student leaders are so valuable in all of the work we do. And certainly, as I said earlier, there is no roadmap as we are going through COVID. And so let's make sure that we are sharing and caring to get through this pandemic. So this slide I like to keep in my deck right now. Most people know who I am, and you heard Christian give a wonderful introduction. So I want you to put your face in this picture here, because I think that there's so much for us to worry about, fret about, be concerned about, be stressed about. And it's always important to take a moment to make sure that we center ourselves and we center the need for self-care. And I can tell you a brief story about me early on in the pandemic, certainly representing the AMA on TV. I wanted to make sure that I was always prepared and up to date with the latest information. And so I found myself watching cable news almost 24/7. And I would even sometimes go to a studio, particularly early on before we had the shelter in place orders, and I would listen to cable news on satellite radio on the way to the studio. And you know what? At some point, I realized that I was not doing well. Overall, doing well. Listen, privilege, able to work from home, not having to worry about my mortgage, not having to worry about will I be able to afford food, but still stress nonetheless. And I realized that I needed to take a moment every day, every morning, center myself, do one thing for me for self-care. And I also needed to turn off cable news. And so I did that. I made sure there were a couple of hours in the day where I watched HGTV. It has certainly been my friend. And if I was traveling to and from locations in my car, for those of you who know me, know I'm a sports fanatic, and we have a great local sports radio station, and I began to do that. So the important thing is for all of us on this call tonight, on this webinar tonight, to remember that we have to center ourselves. And I know as medical students, and really all of us, are experiencing so many disruptions and losses. Some of us have lost friends and family members through COVID. I just found out yesterday that one of my college friends died from COVID. But you know what? Some of us have lost spending time with our family and friends, and we've lost sort of milestones. And I know first year medical students on the call tonight, you've lost the tradition of entering medical school and some of those rituals. So it's okay, first of all, to say that you need help. It is okay to grieve for some of those losses and be disappointed. And it's certainly okay to center ourselves as we work through this. I shared right before we started the call that early on I had a little bit of guilt because I wasn't on the front lines. And I even talked to the CEO of AMA, Jim Madera, and I said, I really feel like I need to go volunteer. I need to go to the hospital. I need to be on the front lines. And he said, Patrice, you need to make sure that you are well and you are able to fulfill your important role as the spokesperson for our profession. So, it still comes and goes. But the key point of this slide is to make sure that you are centering self-care again as we get through this pandemic. It is about leadership, but leadership can happen in so many venues. I've had the pleasure of course, being the president of the AMA, but leadership can happen in your own sphere of influence. But certainly, as a leader, I believe the best leaders appreciate some of these lessons that I have learned on my journey. The importance of teamwork. As a leader, it's not about the title or the corner office or the parking space. It's about the team and the work. And so I think that's important and an important lesson to learn. Partnership and allies. We cannot do anything alone, right? We need help. And it's okay. Sometimes our allies come in strange packages and unusual packages, and they're not the usual suspects. So I think we should appreciate that. I've always thought that it's important to have a broad perspective. Sometimes even in our own profession, we can get in our own bubble, right? And listen to only one another and not have a broader perspective around solutions or what else is going on. And so I think that as we attempt to solve any problems, we need to make sure that we are listening and getting input from a broad perspective. Leaders have a vision for the future. And so as we think about medical student and physician health and wellness and burnout and health equity and the opioid crisis and the overdose crisis and the lack of a mental health and public health infrastructure. Let's get centered and think about what the vision is, because in this country, we tend to go from crisis to crisis. I say we tend to careen from crisis to crisis instead of stepping back and thinking about what is our vision for solving this problem? What is our vision for the future? Advocacy is important. And yes, that's the big advocacy. That's working with administrations, that's working with Congress and our state legislatures, but that's also working at our medical schools, right? At our hospitals, at our institutions, in our own private practices to advocate for our profession, but also to advocate for our patients. And one very important lesson that I've learned, I didn't know this at the beginning of my journey, but I've learned it throughout my journey, is we should always stand in our own authentic voice, our own truth. Now, we absolutely need to be the best we can be, the best version of ourselves. And by the way, that does not mean the perfect version of ourselves, right? That does not exist. I have to tell you that certainly no one would have wished this pandemic on anyone, but I, as a child psychiatrist, was quite worried about our young adolescents, teens that I saw that were so focused on social media. And I think we all know that on social media, I think pre-pandemic, everyone's lives were perfect, right? And I was guilty of this. I would even Photoshop some of my photos, to make sure I had the right, look. And everyone put their perfect lives on social media pre-pandemic. And of course, for adolescents, for those of us who are a little older, we knew that. But adolescents didn't always know that, and they were always worried. At least many of the adolescents in my practice were worried about others not having the perfect relationship and not having the perfect parents. and not having the perfect, perfect grades. I think, this pandemic, we've all been relaxed a little, right? We'll come to these Zoom calls. Oh, Christian has on a tie, but the rest of us are, a little bit casual. I have a sweater, and see, Tom has his hoodie on, so we've relaxed, I think, and allowed people to see us in our less than perfect selves. Some of the best things are when the dogs are walking by and the kids are interrupting. I think that has brought a certain sense of humanity. And even as us as medical students and physicians, I believe that still is hard for us to ask for help, and we always put ourselves last. And I think we have seen now that we are not inhuman. We are human, I'll say it that way. And we can't keep going and going. And we do get exhausted, and there is a limit. And so I think all of these have been helpful, I think, lenses to how we should move forward. And so certainly the AMA has put a stake in the ground to be a leader on many issues, and I'll talk about wellness at the end, but really around COVID, we wanted to make sure that we were providing up-to-date evidence-based information. We were helping students and residents and physicians recover from disruptions in their training and their practices, making sure they had the PPE that they need, working to reduce obstacles that interfered in our ability to give the best care to our patients, and certainly to advocate for science-based, equitable policies. I had the opportunity to be out there in the media. I gave a speech at the very beginning, and I think we didn't even appreciate in April how much we were going to have to fight for those, for many, not everyone, to at least respect the science and the evidence and the facts. And our current president, Sue Bailey, has talked about, fighting on two fronts, fighting misinformation and fighting those who say we are personally benefiting from increasing numbers in COVID. That is something that I believe we never expected. At least we didn't expect the veracity of some of those arguments, but we still do what I said at the beginning of this call, or maybe before you got on, put one foot in front of the other and making sure we are leading on science and evidence and the facts. We all know that equity has been a huge issue that's come before us, and certainly promoting equity in clinical trials has never been more important. And here is a slide that I hope tomorrow will need to change. I think you all know this, and we are down to the wire here. And as you see at the end of the slide, we have no vaccines authorized, but I am going to predict that by this time tomorrow, we will be able to say at least we have one that has the EUA, and certainly we have been on our journey, and a lot of promise here. I am quite worried, and I know you all are, about the concerns that many have, and I know particularly in the Black community, we have vaccine hesitancy, and we have all the issues around misinformation and disinformation. So we are going to have to continue to lead on that issue, lead on health equity. And also, speaking of taking a moment to savor a good moment in this journey we are on, in listening to Dr. Marcella Nunez-Smith being introduced by the Biden-Harris administration the other day, she spoke with that platform, words that many of us on this call have spoken, but never have these words been spoken on this platform: equity, marginalized communities, social determinants of health. And so I think that we are in for continued conversation, again, diversity of opinion and thought, but at least elevating the issue that we have to appreciate that there are so many determinants of health, and we have to work with partners to address some of those issues. Physicians, medical students, we cannot do that alone. A lot of folks are talking about trauma and PTSD. Before COVID, we were at least having these conversations around the adverse childhood experiences. And now we will need to have these conversations around this country, right? And particularly around medical students and physicians, particularly those on the front lines. And unfortunately, you all had Dr. Lorna Breen, who died by suicide. And let's just, say that suicide is very complex. And I'm not saying we can draw a straight line from issues around COVID directly to, her death by suicide. I happened to do a webinar with her brother and sister-in-law, which actually gave us the wonderful opportunity again to elevate physician health and wellness and the issue of suicide in medical students and physicians. Uh, Leadership in leading and addressing equity. And hopefully in June, you saw that the board pledged action on racism. And just this past November, the House passed policy, building on the policy passed again and spurred initially by Misney to create the Center for Health Equity. But we now have policy that racism is a public health issue. And so as we continue to work towards everyone having equitable access to affordable, meaningful health insurance, the AMA is committed to continuing on that path. As you all know, AMA has very strong policy, by the way, thanks to the work of the medical students who've been such advocates around mental health policy, again, for our patients and for ourselves. So we do have the policy that leads us to our advocacy work, again, both at the federal and the state level. We are continuing our work to increase diversity, and that is a key issue, I believe, in both the wellness of our patients and the wellness of our profession. But clearly we are here tonight really to talk about issues. And you know these statistics. I really want to hear from you all around the issues that you all are struggling with. Remember, there's no playbook. Remember, it's okay to ask for help. And remember that you all are experiencing issues that medical students before you have not had to deal with. And so we do need to continue to elevate these issues. We do need to continue to work around issues of stigma. I remember when the first time I had to apply for my license, there was a question and it said, have you ever been treated for a mental disorder? And I thought, particularly as a psychiatrist, I knew how stigmatizing that question was. And luckily we, and most of the states around the country have changed that question, but it still is, if we're very candid, very difficult for us to admit when we need help. Again, a silver lining in the pandemic is one night I was on Twitter, and I think one of our colleagues just decided they were going to take the plunge. I know who this is. And she said, my name is, and I'm just Susie Smith, and I am being treated for depression, and I have taken medications before. And when she posted that first tweet, there were so many medical students and trainees and physicians saying, me too. And I thought that was powerful. And that's a path forward in us being able to talk about this, because we see the rise of physician burnout. We see the reasons why. They are many, but most of those reasons are systemic issues. And so at not having the PPE we need, worrying about putting our loved ones at risk. Remember early on, some physicians were writing wills, wondering about safely reopening practice. How do I learn as a medical student? How is this going to impact? And as a resident, as I'm interviewing, as a fourth year medical student, as I'm interviewing for residencies, how is this going to impact? So all of these issues have certainly impacted our mental health and our wellness on a foundation where we already seeing increased burnout. And certainly at the AMA, we have focused on systemic issues. If some of you remember, the original conversation was, oh, physicians and medical students, just get more sleep and eat healthy, nutritious meals and take care and do yoga and meditation and you'll be fine. And we have been able to, with lots of partners, change the narrative on that. And it's about changing systems to address burnout. And recently I did one of our AMA bi-weekly updates. and talked. You see Jeff Lieberman, who's chair at Columbia, talked about these issues in really practical ways to fight burnout and address issues around increasing substance use disorders and increasing issues around stress and trauma and mental health issues in our patient population, as well as our medical students, trainees, and physicians. And so again, thank you for the opportunity to chat tonight. I just wanted to whet our appetite in some issues that I hope stimulate some questions and a great discussion for the rest of the evening. So thank you very much for the opportunity to be with you tonight.
Great.
Now,
Yeah.
I'll
Thank
share.
you so much. So now I'll be moderating the Q&A session. So we're first going to start with the questions that students submitted in the pre-registration link. So can Jessica Bendy from Tora please ask a question?
She'll need to raise her hand.
Oh,
so
yes.
I could
Can you please
unmute
raise
her.
your hand, Jessica? Great.
Can you hear me?
Yes.
All right, I'm sorry for the cat fountain. I forgot to turn it off, so enjoy some relaxing trickling water, everybody.
Love it.
Thank you so much, Dr. Harris, for your presentation. It was really eye-opening, and I just got done with my finals, so it was really refreshing to get information and not be worried if I'm being tested on it. So my question was really more about how the AMA is going to support the medical students through COVID, not just emotionally and mentally, as I know that you guys have been putting out in your newsletters, but also thinking about the strange financial strains that has been put on each student to be in COVID medical school and what that entails. I know living in New York, we've had to make a lot of ifs and buts and make our budgets work in different ways so that we can stay safe but still continue to get our education. And if we're doing any work in the clinics, it's another fight to make sure we get enough PPE, et cetera. So I'm just wondering what the AMA has been thinking about that, and if there's even been a chance to think that far forward with everything going on.
So I would say a couple of things. Make sure you go to the AMA's COVID-19 resource page, because we have several resource documents around the work that we have done so far for medical students and trainees. And we were very focused early on, let me just say, about some of the medical students, because we learned, and you all know, and if anyone on the call experienced this, we knew that some medical students were called into the hospitals and were asked to do various duties. And by the way, it was our understanding that these duties were appropriate to your skill, but still you were being called in. And so we, the AMA has the bully pulpit, if you will. And so we amplified issues around making sure that you were safe. We amplified issues around our folks thinking about health insurance, right, for you, if you're going to be called into service or come into the hospitals. Financial packages. And we, of course, have strong partnerships with ACGME, and we worked with them on solutions. Our Susan Skochalak, who leads our medical education team, was in constant contact with ACGME and LCME. We had our ears to the ground. The medical student section, both the section leaders as well as the medical student representative, Blake Murphy, on the board, raised these issues. And where we could, we offered solutions, or Susan was in immediate contact with, again, ACGME. So I would tell you that we've always been, again, concerned about medical students, the transition, medical student debt, just many issues that you are addressing, that you are facing. And we will continue to keep our ears to the ground. I hope that you continue to let us know, either directly or through the medical student liaisons here. And then we use our bully pulpit, right? We use our bully pulpit to address those issues and take those issues to Congress if need be, to state legislatures if need be, to policymakers if need be, regarding again, ACGME and LCME.
Thank you so very much for reminding us and also giving us a new way of looking at information so that we can continue to rock on in school and then make you guys proud once we're out of all of this.
We know you will.
Okay, so our next question will be Deepa from NYTCom. Please raise your hand, Deepa.
Right, NYTCom represents. Just to interject, we're very pleased with the turnout from our two respective schools. Thanks for being here, especially, and to everybody else. Thank you for being here. All right, Deepa, you're up.
Hi, can everyone hear me?
We can.
All right. First of all, thank you so much, Dr. Harris, for being here. I just had a quick question about sort of how you would recommend coping with all of the uncertainty. I think, with everything going on in the news, with the election, with, our status on vaccines, I ask this because, as a medical student, as medical students, we are still expected to perform at pre-COVID level when we are, still in a pandemic. And because, I've got a lot of friends and family asking me this question. Before it was, how do I treat a cold? And now it's, how do I deal with uncertainty? So, the question has definitely gotten tougher. So I'd love to hear your expertise on that.
Well, I always say, and I think that's a considerable source of anxiety when we don't know what's around the corner, when there's huge issues around uncertainty. So I have said to my patients, and whenever I've talked about this issue, is the first thing is to recognize that we are not helpless, that there is something that each one of us can do. Now, it will be different, but there is something that each one of us could do. And so all of our routines were disrupted. And so what I tell folks is try to develop a new routine. It won't be the same routine, of course, but I think it's helpful to have a routine. You may be uncertain about what's going to happen with the vaccines, what's going to happen with COVID, but you can be certain about your new routine. Call on your usual coping mechanisms. That might be meditation, that might be prayer, that might be exercise. And I can tell you that I have put on, I believe, the COVID-15 because I have not been getting as much exercise. And some folks think, oh, we can't get to the gym now. And so what I've been trying to do is put on, my favorite, I was going to say album, but that would date me. And you all absolutely know how old I am. The medical students may not even know what an album is, but put on your favorite music or song and just get some physical activity. Do try, to eat as healthily as you can. Certainly we are all snacking, but certainly want to watch that. Folks want to watch, increased intake of alcohol. We certainly want to make sure that we are getting as much sleep as we can and continuing some of those routines. It might be tempting, since maybe you don't have to get up as early in the morning as you used to, or you'll stay up a little longer, you'll, watch Netflix or something until 3 in the morning. But again, that gets back to the point about, keeping routines, using your coping mechanisms that you, have used in the past, exercise, eating right, sleep, trying to get outside. And I realize I live in Georgia and I live in a cul-de-sac, and that's different than New York. And of course, but try to get outside when you can, even if it's walking around the block, wearing a mask. Again, that's how you can be in control, keeping your distance. And here's the most important thing. When you do find yourself unable to, continue to keep up your sort of daily responsibilities, your work responsibilities, your personal role responsibilities, it is absolutely okay to ask for help. And I encourage everyone to do that. Now, I hope some of the systems and some of the medical schools, and you can tell me if this is happening, are developing what I call pull support systems, so that folks don't have to ask for help. There's some routine, way every Friday at 10 o'clock, we're going to get together and talk about some of these issues, so you don't feel like you have to ask for help. There are some routinized way that folks can give feedback and share what's going on with them. So if that's not happening, maybe you can suggest that at your medical school or your institution. But the key thing is knowing that we are not helpless, even though there is a lot around us that is still uncertain.
Thank you so much, Dr. Harris.
Oh, let me just say, because we were talking about isolation before many of you got on the call, and that's certainly an issue. And you, of course, many of you don't have the opportunity to have that camaraderie and meeting folks in person. And that's another, I think, again, silver lining in this horrible tragedy is I think we now appreciate the value of human connection. And I have to say I'm biased as a psychiatrist. But people were beginning to say, well, do we need to meet in person? This technology stuff is pretty good. Maybe we really don't need to meet. Maybe we really don't need to go to class. Maybe we really don't need to gather together. And so I think now people are realizing that again, and there's not an either or, they're hybrid models, because I think we're all learning that there's increased engagement on Zoom, right? More folks might attend meetings that didn't attend meetings before, but I think we all are missing that human touch. And I think that's been, again, a silver lining. And right now, when we can have that face-to-face human touch, we can take advantage of technology. Now, I will say this, maybe everyone on this call, obviously, we have to recognize that we are privileged. Everyone on this call has a data plan. You have access to internet. You have a cell phone, an iPad, or a laptop. Many of our patients and maybe some of our family members don't have that. And so, and a lot of seniors certainly didn't have data. I know my dad, and I realize this, I'm not generalizing. I know some 86-year-olds or more tech savvy than I am, but my dad is not. And so what I did, but I was unable to see my dad for the first 6 months, but we talked on the phone every other day. So sometimes it's that old fashioned, picking up the phone and calling someone, but it's that human, that connection that I think we should try to maintain as best we can, even though we can't be physically together.
So actually, now that you've talked about isolation, we have a question more relevant to that. Some people may not feel satisfied without like in-person interaction. And now due to limitations on social gatherings and socializations with COVID, some feel like some students are really suffering alone in absolute isolation. And, many of the students have refused to, reach out for help. So Dr. Harris, like, do you, is there a way for us to identify these students and tell us how we can better reach out to them?
So I would say, and that's delicate, but that's where the push comes. And so if you notice that some of your classmates no one has talked to lately, no one has seen lately, that's the opportunity to reach out to them, as opposed to waiting for someone to reach out for help. Call, how are you doing? I'm having some struggles, and sometimes it's that shared lived experience. That's why I have been making it a point to share my lived experience in the day that I just didn't feel okay. And I wrote an email to the leadership of the AMA again saying I'm not okay, but I did put it in perspective because I was still privileged. So I would say reach out if there's some of your classmates that you haven't talked to. You could do things like, again, take a basket or have a basket of treats delivered, find out what their favorite, thing to do, maybe a hobby or, something, just make sure you're reaching out and saying, are you okay? What do you need? And some people will say, I'm fine. And then the next question may be, listen, what can I do for you? What, it doesn't have to be, you don't have to be in distress necessarily, because you want to give folks an opportunity to share at their own pace, but just let them know that you're there for them. Somebody's there to listen. And how could you help? But I think we do have to be proactive for folks that we have not seen from or heard from in a while.
Yeah, to jump on that, like the proactivity part of it, I think what I was kind of getting out of that was that it's okay to share what you personally have been feeling with that person that you're reaching out to. You know, I think sometimes students, they wonder, what does it actually look like to do the reaching out? Is it just a text? Can it be just like literally calling them out of the, I'm a big proponent of that, just calling people, you know, no like hey, are you free now? Just call them. You know, what's the worst that can happen? They're busy, they don't answer. Then you leave them a message. You know what? Who doesn't love to get a voice message? I know that, again, that's like something that's kind of gone today, but I feel like that's a great way to reach out to somebody, even if you don't converse directly right then and there, but to just leave a voice message so they hear your voice and then call you back. Would you agree, Dr. Harris?
Absolutely. And that's why I said, you know, you're picking up the phone, I would prefer that or recommend that as the first. And again, even if you leave a voice message, because it's that voice, it's that human connection, which I think is more of a connection, although texts are fine. But I think that first contact is the phone and a phone call. And again, you know, your first question could be, what do you need? What's your favorite food? You know what I mean? You know, you like pizza? I'm going to send over a pizza. You know, what pizza do you like? You know, and you start there. You know, sometimes people are a little, although let me just say this, if you really are worried about someone, you should ask. But, you know, if you're not sure, you want to, you know, start with, I'll send over a pizza, I'll send over a movie or a book. Here's a great book. You know, I'm reading Barack Obama's book. Here's a good book. Another book is Caste, Isabel Wilkins. But, you know, or sometimes, and maybe it's a fun book. Maybe it's a Dr. Seuss, you know, book. Just something sometimes to lighten the load and send over for them to do. Find out what they like, though.
I think so. That's an important point to, you know, to recognize that, you know, there's situations that actually might go toward the serious side of things, and maybe that's something we can bring up toward the very end with Dr. Rothberg and talk about PeertoPeer, which is a program here in the state of New York.
Oh, great. By the way, if any of you, you know, have families or, you know, because it's hard to do this if you are alone, but I am so excited about board games. You know, because I think we do need to have digital detox. I didn't say that before, but I think, you know, I talked about, you know, turning off cable news. And you know, I think it's a little bit better for everyone but me here in Georgia. But it's a little bit better now that the election has passed and we don't have, you know, the ads. I do, but I'm okay. I'll get through it. You know, the most frustrating thing is to turn the channel and the same ad is on a different channel. But that's me here in Georgia. So you guys might need to call and check on me, you know, once a week as until January the 5th. But again, for families, you know, again, maybe we can get out of the everyone on their iPad and everyone on their phone and Monopoly. I realize for some of you, so for some of you who didn't grow up with board games, for those of you who did, reintroduce yourself to board games. And for those of you who did not, introduce yourself to some of those board games, Monopoly, Sorry, some of those games that I used to play in my younger days.
Great, thank you. So at this point, we want to open the Q&A forum to all students. Please feel free to raise your hand if you have any questions. I guess someone raised their hand. Oh, it's for Madison, NYT Com.
Let's give it another second before Madison goes, because I know she had another like pre-asked question. Is there anybody here that has a question that didn't ask one, you know, in our RSVP form? We really want to give anyone the chance to you know, interact and chat with Dr. Harris here. I mean, it's such a cool thing that we have her. But if not, we have plenty other questions. So if you do have a question, just raise your hand. Oh, I see another hand. We have a Martin John. Let's see. Yep, there we go.
Hi, can you hear me?
I can.
Hi, I'm very happy to have been able to hear you speak. Thank you so much.
Welcome.
I guess my question is a fear for students in when they want to reach out for help, um, and trying to establish maybe a psychiatrist to visit on a daily basis or weekly basis, is that at the same time that they need the psychiatrists or therapists to be close by. This may not pertain since like COVID, there's a lot more like teleconferencing, but once this may die down and people desire a more in-person contact, there is a fear that because they're going to an area more local, a psychiatrist more local, they may know people that know people that know people in any connection and know you have connections with, and that can scare people into not getting help. How can someone like maybe reframe this, or how can someone feel a little safer when trying to call for help, but feel as though any kind of connection leaves like almost a paper trail?
You know, that's a real fear, and I don't want to minimize that fear. Unfortunately, we are in a much better place than we were 10 years ago. There's even more protections around privacy and confidentiality. Now, I might say, and I will have Frank maybe speak on this, because I think Frank sees a lot of professionals, and Tom and Charles also may have some suggestions for you there in New York. I guess I might, and you know, as big as New York is, you know, it's still sometimes a small professional community. But here's where I would, you know, rely on your senior colleagues from New York to make some suggestions about where to go and how to navigate that. I just hope, and we're not there yet, but that's why I really try to routinize and normalize help seeking. And no, we're not there yet, but um, I hear you, and I agree with you that we are still in a period where we have to worry about, where people are sometimes worried about their attendings or their colleagues knowing that they are seeking help. But I do see a glimmer of hope, and I to me, that was that you know, first a doctor, and by the way, I think it was Esther Chu who did this, so I think I see the tide turning here, and folks are more comfortable, but we are still on our journey on that. You know, again, that's where perhaps using telehealth does help. I mean, if someone is really worried that seeing someone in New York, you know, they just don't want to do that, that's where you could see someone, and not New York City, but maybe see a psychiatrist in upstate New York. But I want my New York colleagues to talk more about that for you guys in New York.
I'd be glad to build on
Yeah, I think
Dr.
Frank should speak to
Harris's
that.
comments. You know, I'm certainly not looking for people to call me. That's not why I'm going to say what I'm going to say, but the reason why each of our offices are in regular office buildings with dentists, lawyers, accountants, other service-oriented professionals is because somebody could run into someone in the hallway or run into someone on their way to or from a restroom, and no one can assume they're coming to see a psychiatrist who's in the building. And that's by design, because I treat so many cops and docs. That's 2/3 of who I see in my practice. You know, I wish that were not necessary, but I don't think that my current patients should have more angst and possibly lose opportunities on their career path to pave the path for others. I think we all have to pave it for everyone. And until then, people need the protection they're comfortable with. But video telehealth, I think, is a great idea. And the reason why we were fortunate enough to be able to get both our practice sites up and running the day after the shutdown in New York is because we were already in the process of setting it up. And the main reasons were for those professionals who can get stuck at work, but now they can still make a visit. Just do it from the parking lot instead of sitting across from me. But the other part were the privacy issues as well, and particularly for young doc students and residents who have less control. I think that even in New York, as large as it is, and there's so many docs on Long Island, for example, thousands, probably 10,000, Northwell covers, the majority of docs now. So now, does a Northwell doc who's got a stress-related problem, depression or OCD or whatever, have trouble finding a doc when Northwell's insurance covers Northwell docs? Well, I think we need absolutely for students and training physicians to offer them insurance or some way of making care very affordable outside the network. Nobody wants to go to the company shop, as they say. I think that's also true for attending physicians need a way to go outside. And that's part of the reason why our peer-to-peer from the beginning, even before the pandemic, we were thinking about offering video visits, privacy, HIPAA privacy secured, so that docs in an area in upstate New York where 80% of the docs could be in one system can see someone outside that system. And that's just for peer-to-peer, which may lead to a mental health referral. So I think we need to keep putting our heads together and to talk about exactly those things. And on our agenda is to talk to students to start figuring out, well, what really would make it worthwhile? No cost, but then if that's the people that are directly connected to the school, low cost through the insurance plan, but a 3-month wait. Well, half the psychiatrists in New York, certainly more than half, don't take the plan. So how do we make it affordable? How do we reach out to docs to decide maybe I'll do a courtesy for a student, whatever it is, but it's going to be a combination of things. And what I'm hoping is that we can offer whichever one of those pathways works for the student at the time that they're reaching out.
If I may add to what Frank just said, Martin is your name?
Yes.
Yeah. I think you were asking a slightly different question. I think you were asking, how does a person get started with the first interface? Am I correct in my analysis of that? Because if you were, I think the Medical Society is a great place to start. We're, your organization, we're just a group of physicians. We're not your employer. We're not your preceptor. We're not your attending. And to build on what Dr. Dowling said about the peer-to-peer program, which is designed this way, we have access to, networks of resources throughout the state so that you can have that sense of privacy. You're not necessarily going to be seeking help or conferring with somebody who you may know or who may be just 6 degrees of separation. It could be somebody completely comfortable for you. If that was your question, I would like to answer it that way. The Medical Society could be a great resource and an anonymous resource.
And I hope again that push to put that information out there, just say, we'll call the Medical Society, but maybe at the next Medical Society meeting, there's, there's the resources, and here's what we're going to do. And, and so that people don't have to ask, but we here's the information.
The other thing I think we need to work on is to continue to destigmatize treatment of mental illness and acknowledge that, we're human. A significant number of us through our professional careers will go through issues. And it's always been disturbing to me that we don't really have a particularly organized system to do that. It's challenging because of the way we change our different venues, but we need to come up with a system that allows us to self-assess and allows us to have a peer or someone available to us as we move along from student to resident to fellow to practicing physician. Some of my medical students at the University of Rochester started to try and create that. And I think we need to look at ways that we can have, non-intrusive self-assessments and somebody available to us that we know we can call to, somewhat like Patrice had indicated in terms of having small gatherings. But I think there's ways to do it. And I think the deans are interested in doing something like that. So I think that would be a really great project for the MSNY student chapter. And I think if we can figure out a way to do that, that can be brought to residency, fellowship, and ongoing into to help us all navigate our life cycle and professional cycle.
Yeah, absolutely. I mean, these are all things that I think we're all looking to sink our teeth into. And we could definitely continue the conversation in a little bit here, but I do want to be mindful of time. Now, Dr. Harris, do you have time for maybe one more question or? I know that,
Yes, I have time for one more question.
okay, great. Madison, I know you've got your hand up. Do you mind asking it?
Wait, can you hear me?
Yes.
Okay, sorry, I wasn't muted. Hi, Dr. Harris.
Hi.
Madison Salvetti, OMS1 at NYIT Com. My question for you is, I know Zoom's great. Yesterday, I think I had 4 or 5 Zoom calls, and it keeps us connected, but at the same time, I know myself and my colleagues feel fatigued. How do you suggest combating that Zoom fatigue to be able to stay connected, but also not exhausted by the end of the day?
And I think, that's just like sometimes we have to turn off cable news. And so now sometimes these Zoom meetings are not by our own design, right? I think I've had 8 Zoom meetings today, and this is the only one that, is sort of by my design. The rest of them were other meetings that someone else had, requested that I attend, but it's all good work and fun work. So tomorrow, and you to the degree that you can control it, you space your Zoom meetings out. One thing that I learned for a minute there, I would agree to a meeting from 3 to 4 and 4 to 5 and 5 to 6. And so what I've done now is make sure when I can, there's 30 minutes between meetings. And in between each meeting, I try to, walk around my house. I try to walk outside, walk around my cul-de-sac if I can. I try to make sure that I have enough water and stay hydrated. And lately I've been trying to stand. And so I don't, if any of you have any standing desk, and you don't have to have a standing desk. To the side here, I have a bookshelf. And so sometimes I'll put the laptop up on a higher shelf so I can stand because sitting, as much as we probably are doing now with all these Zoom calls is not healthy. So when you can control it, make sure you have enough space between calls that you can do something else. Stand. I've seen people, Willarda, one of our current fellow board members, Tom's and I, she walks on her treadmill during our meetings, during our AMA board meetings. She'll say, I got 6.5 miles in, during the morning's board meeting. So if you have, a treadmill, and you can, in some meetings, you don't have to be on camera. It's okay if you're just listening. So turn off the video and, get on your treadmill. So I think those are the things that we can do, and try to actually maybe have some Zoom calls that are fun. Like if you're, having a cocktail hour or beer or wine hour with your friend. So the Zoom is not all about business. So those are just a few things that I'm doing to help with that Zoom fatigue. But I would give anything to be in New York with you all, right now in person. And we'll get back there. We'll get back there. But until then, we have to try to manage as best we can.
Thank you so much. That's great. That's all great. I love the walking on the treadmill. That's
Yes.
fantastic.
Wow, definitely. Well, mindful of the time, Dr. Harris, especially what you just mentioned. You've been on Zoom all day, so we definitely won't hold it against you if now is the time to go. As a parting question, could you just briefly chat about what comes next for you?
Yes, as I'm immediate past president. I'm still on the board, but that tenure will end in June. And I am very fortunate and blessed in that several opportunities are coming my way. One you will probably hear about in the next week or so, because it's going to be an exciting, I hope, development in making sure that testing is accessible to everyone. I think, and you all experienced this early on in New York, that testing sites were sometimes in neighborhoods and locations where not everyone could get there, or if you here in Georgia, where we are in love with our cars, they had drive-in sites, but what if you didn't have a car? So I've been working with some entrepreneurs and tech folks on that. So stay tuned. I've also accepted a couple of corporate board positions. One is a bank board, which is nothing to do with healthcare. So I'm learning about finance. I know nothing. If anyone wants to give me a primer on finance and banking, I'm learning as much as I can. And you know what? I think that's always important. We're used to the concept of lifelong learning in our profession, but I would encourage everyone to commit to learn something outside of our profession, right? And it doesn't have to be a hobby or craft or something, because sometimes we spend so much of our time in the medical world and with our work that we forget that we should also, make sure we're learning about. And for instance, I really think that this election and some things are really encouraging us to learn more about government and civics and not necessarily politics, but really how our government should function and how we can play a role in a functioning government where there is a marketplace of ideas. I'm really bullish on a marketplace of ideas and folks coming together with different perspectives to solve problems. No one has the market cornered on information. And so that's why it's so important that we commit to intergenerational learning. I know sometimes us old codgers think we know everything, but I always say, listen, we need to learn from our younger colleagues, and hopefully you all feel that there's some wisdom gained in learning from us. So those are just some broad generalities or what I'm going to do next. You heard about Columbia. I'm now visiting professor at Columbia, working on issues actually and supporting them with Department of Psychiatry and thinking about diversity, equity, and inclusion, and how we can look at that from a perspective of academic institutions and leading institutions. And so those are just a few of the things that I'm involved in.
Wow, that all sounds wonderful, and I think we're all going to be staying tuned in to see what comes next. I did happen to find the everyday health.
Yes.
appointment
Oh, yes.
coming
Yes.
up, and so I'll be excited. I did take a listen to that, and I'll put it in a follow-up email. Your interview with the editor-in-chief there, and I mean, I thought that that dovetails nicely with this. We're looking to incorporate health and wellness into our everyday lives, which maybe look a little different this year compared to med students of the past. But that's, I think what you said about creating a new routine is such a wonderful thing here. And so with that, I know we're a little over time. We've been delighted to host you tonight. Really, really appreciative of your wisdom and your being gracious with spending an evening with us. If you do have to go, that's okay. I think I'll stay on for a little bit, and then any of our other panelists that can stay, that would be great. But we really thank you, Dr. Harris, for spending some time with us.
Well, thank you. And if I get to New York on behalf of Columbia, let's make sure we see one another.
Oh, I'd be so happy. Let's hope that this vaccine works, and that we're, I'm thinking by springtime. Would you kind of agree? Is there the chance for opening up if we see widespread vaccination?
I think spring might be a little early. I think maybe by June or July, and it's going to be gradual. But that's my prediction. It'll be the summer. We still will have to wear a mask and do certain things, but I think we'll see a gradual reopening as more and more folks get vaccinated, get tested, and we have a robust testing and screening and surveillance strategy. That's my prediction. Let's hope so.
So well, here's the hoping.
Absolutely. All right. Take care, everyone. Thanks for having me.
Thank you.